It's important to remember that essential oils and other aromatherapies like lotions can make eyes very sensitive, so you don't want to use near eyes. You have to be very careful when you're wearing any kind of a scent, especially in the hospital setting, because people are sick and can be sensitive to the smell. They can cause headaches and sinus symptoms. We had a student once who came to school every single day absolutely reeking of thieves oil, which is a particular kind of essential oil that people swear reduces infections. And I mean, she'd put it on cotton balls and put it in her ears. She'd rub it all over, and you truly could not stand the smell. It was instant headache, and we talked to her about it, and she considered it her health care, and eventually chose to leave school rather than stop wearing it or wear less. So it can be really, really difficult, but people in the hospital setting cannot stand strong scents. And think of our room, you know, how closed in it is. You have to be careful for perfumes or lotions or anything like that. Since essential oils have gotten more popular, there are increased cases of children having problems with the essential oils, and they can negatively affect your pets, especially if you have cats. Cats metabolize substances totally different than humans and dogs do. And so an aromatherapy oil that you diffuse in the air might not bother a dog, and you might find it very relaxing and pleasing, but sometimes pets can't metabolize that, especially phenols, it's an oil found in mint oils, peppermint, wintergreen, clove, and it can make them really, really sick. Chiropractic care. Chiropractic uses hands-on treatment in which the joints and bones are manipulated. And the theory is that if your spinal column is properly aligned, it frees up nerves and other circulatory processes like lymph and blood, and it will improve your overall health. There is really no proof to that. The body is definitely able to heal itself, but sometimes it needs surgery and medication, and chiropractic practitioners think that they can avoid this. It's very valuable in the cases of low back pain or when there has been problems with the joints. But there's a lot of practitioners of chiropractic are kind of exceeding their bounds and calling themselves doctors, which they are not. They are not medical doctors. You can have a doctorate at your particular chiropractic school, but that's not a medical doctor. And while it can be very good for the joints and the skeleton to help heal from some kind of a traumatic injury, when it comes to just overall curing of other problems, you got to be really careful. They can be a pain relief alternative for anybody who's got certain skeletal problems. And a lot of times they'll use physical therapy and good nutrition mixed into that treatment, and that can be valuable. But if a person has prior medical issues, prior skeletal issues, it's not a good idea to use chiropractic care without consulting a physician. And WebMD talks quite a bit about this. And there is a certain link to a history of strokes. There have been documented cases of people who get their neck and upper back manipulated, and it can do damage to the big blood vessels in the neck. So there is somewhat of a risk. Acupuncture. Acupuncture is a form of treatment that involves needles, which everybody loves needles, right? But you insert these very, very thin needles, people swear you can't even feel it, into specific points on the body along lines that they call meridians. And it's said to stimulate certain areas of the body to heal in some fashion and give you overall positive effects. I got this information from something called Medical News Today, which really isn't a respected medical journal, but it did have some interesting information. There are risks such as going too deeply. There have been cases of infection from people not properly using the needles. If needles are reused, of course, there can be any number of infection risks, and you hope that acupuncture practitioners are not reusing needles. They're supposed to come pre-sealed, pre-sterilized from the factory and factory wrapped. Otherwise, they should not be used, but there have been past cases. Acupuncturists have to be licensed, and I think they have some pretty strict protocols, and some people report getting really great benefit from acupuncture, others not so much. Once again, I mean, if you have the money to try it or your insurance pays for it, it's worth a try. Can't hurt, might help. I'm enclosing the link to, I think, a hilarious video. It's not a video, it's just the audio of part of a comedy routine by Bill Engvall that I think is really, really good. So I'm going to include the link after this. Massage. Massage therapy. There is literature talking about massage going back thousands of years. Various places throughout the Mideast and the Far East have references to various kinds of massage. So massage therapists work on your muscle, and they knead and manipulate soft tissue to help you feel better in a number of ways. Swedish massage uses very long strokes, tapping, vibration, kneading, and it's said to be very beneficial to the muscles and thought to be very relaxing. Sports massage uses techniques from the various kinds of massage to release muscle tension, and it's particularly adapted to the needs of athletes who, of course, have a lot of joint and muscle stress. Myofascial trigger point therapy focuses on what are known as trigger points, and those are areas of the body that are really, really painful when they're pressed on. And if you have these sensitive trigger points, sometimes they're linked to pain in other areas of the body. So you can read about the benefits of massage on this NIH website, and some people really swear by it for relaxation.